Hello and welcome. Today we're diving into the world of neurology to explore a rare but fascinating condition known as Miller-Fisher syndrome, or MFS. This neurological disorder, a variant of Guillain-Barré syndrome, presents with a unique and distinctive set of symptoms that can be both intriguing and challenging to diagnose. Let's unravel the complexities of MFS together. So, what exactly causes Miller-Fisher syndrome? In most cases, MFS is considered an autoimmune disorder triggered by a preceding infection, most commonly upper respiratory or gastrointestinal infections. The infection stimulates the body's immune system, but instead of solely targeting the invading pathogens, the immune system mistakenly attacks the body's own nerve cells. Specific bacteria like Campylobacter jejuni, Haemophilus influenzae, and viruses such as cytomegalovirus, CMV, have been associated with FS development. The precise mechanisms that lead to this autoimmune response are still being researched, but molecular mimicry is believed to play a significant role, where bacterial or viral antigens share structural similarities with components of human nerve cells, confusing the immune system. To understand MFS, we need to look at the pathophysiology. The misdirected immune response primarily targets the peripheral nerves, specifically those responsible for controlling eye movement, balance, and reflexes. Antibodies, often of the IgG type, are produced that bind to gangliosides, which are complex glycolipids found on the surface of nerve cells. A key ganglioside target in MFS is GQM. These antibodies disrupt the normal function of the nerves, leading to inflammation and demyelination, the damage or destruction of the protective myelin sheath around the nerve fibers. This damage impairs the transmission of nerve signals, causing the characteristic symptoms of MFS. Miller-Fisher syndrome is a relatively rare disorder. Precise epidemiological data can be challenging obtained due to its sporadic occurrence and potential for misdiagnosis. However, it's estimated that MFS accounts for about 1–5% of all Guillain-Barré syndrome cases worldwide. While it can occur at any age, it's most frequently diagnosed in adults. There may be a slight male predominance, but this isn't consistent across all studies. Geographic variations have also been observed, with higher incidence rates reported in some Asian countries. The hallmark of Miller-Fisher syndrome is the triad of symptoms: ophthalmoplegia, ataxia, and areflexia. Ophthalmoplegia refers to paralysis or weakness of the eye muscles, leading to double vision and diplopia, or difficulty moving the eyes. Ataxia is characterized by impaired coordination and balance, resulting in an unsteady gait. Areflexia is the absence of reflexes, typically the deep tendon reflexes like the knee-jerk reflex. While these three symptoms define the classic presentation, some individuals may experience other symptoms such as facial weakness, bulbar dysfunction, or sensory disturbances. The severity of symptoms can vary from mild to severe. Diagnosing MFS involves a thorough neurological examination and consideration of the patient's medical history. The presence of the classic triad ophthalmoplegia, ataxia, and areflexia is highly suggestive of MFS. However, to confirm the diagnosis and rule out other conditions, several tests may be performed. These include nerve conduction studies in NCS and electromyography (EMG) to assess nerve function, cerebrospinal fluid (CSF) analysis to look for elevated protein levels without a significant increase in white blood cells and albinocytologic dissociation, and blood tests to detect the presence of anti-GQTEM antibodies. MRI of the brain and spinal cord may also be performed to exclude other neurological disorders. While Miller-Fisher syndrome is considered a variant of Guillain-Barré syndrome and shares its autoimmune nature, MFS doesn't typically have further sub-classifications or subtypes beyond its core definition. The symptoms are quite specific. Some clinicians may use the term FS overlap syndrome when the individual shows features of both MFS and typical GBS, like limb weakness, in addition to the MFS triad. The treatment for Miller-Fisher syndrome is primarily supportive. Since MFS is often a self-limiting condition, many individuals recover spontaneously. However, treatments aimed at modulating the immune system, such as intravenous immunoglobulins of IgG or plasma exchange as plasmapheresis, may be used in more severe cases or when recovery is delayed. These treatments work by removing or neutralizing the harmful antibodies that are attacking the nerves. Supportive care includes physical therapy to improve balance and coordination, occupational therapy to assist with daily activities, and speech therapy for those with bulbar dysfunction. Monitoring for respiratory complications is crucial, especially in severe cases, as respiratory muscle weakness can occur. Currently, there are no specific preventative measures for Miller-Fisher syndrome, primarily because the underlying causes are not fully understood and often involve unpredictable triggers. However, steps to minimize the risk of infections known to precede MFS, such as practicing good hygiene, getting vaccinated against common respiratory illnesses, and ensuring food safety, may indirectly reduce the likelihood of developing the syndrome. Furthermore, prompt treatment of identified infections may theoretically reduce the risk, though this has not been definitively proven. The prognosis for Miller-Fisher syndrome is generally favorable. Most individuals experience a full or near full recovery within weeks to months. However, some may have residual deficits, such as mild ataxia or ophthalmoplegia. Relapses are rare. Recent research has focused on understanding the specific immune mechanisms involved in MFS and developing more targeted therapies. Studies are also investigating the role of specific gangliosides in the pathogenesis of MFS and exploring potential biomarkers for early diagnosis and prognosis. These ongoing efforts promise to improve our understanding and management of this unique neurological disorder.